Friends, I am Dr. Rahul Bhargav, Director of Hematology and Bone Marrow Transplant at Fortis Memorial Research Institute, Gurugram. Today we are going to talk about multiple myeloma. As we know, multiple myeloma is a disorder of plasma cells. It's a type of blood cancer which originates from the bone marrow and affects low hemoglobin along with lytic lesions of the bone because it is expanding in the bone. Because of lytic lesions in the bone, the calcium can go up, and if the calcium can go up, it can affect the kidneys. Kidneys can get hampered. So people can come to the doctors with anemia, back pain, unexplained renal failure, albumin globulin ratio being reversed, tingling numbness, and the predominant thing is the back pain. So once the patient goes to the doctor, doctor tends to see the blood counts and a serum protein electrophoresis. Yes, the word is serum protein electrophoresis if you are suspecting multiple myeloma. In CBC you see low hemoglobin. In liver function test you see AG reversal, albumin globulins are reversed and the calcium levels are raised. At this present moment of time we don't know why it causes, who will get multiple myeloma. Yes, but it's a disease of the 5th and 6th decade, generally tends to affect. So you need to be aware of this thing very well. Fine. Once it's been thought, once it's been suspected, then what do? You do bone marrow test, you do fish test to know what is happening and what kind of a multiple myeloma you have. Multiple myeloma can be a good type or a bad type, but what you require is the chemotherapy for sure. And in multiple myeloma, chemotherapy is very, very simple. Okay, the 4-drug combination daratumumab, bortezomib, lenalidomide and dexamethasone is being given. So daratumumab is an injectable medication, bortezomib is a subcutaneous injection, lenalidomide is an oral medication, dexamethasone is an oral medication. Up to 70 years of age, you do bone marrow transplants. By doing bone marrow transplant means you give high dose chemotherapy to kill all bad cells and put the stem cells back inside so that they can grow back to normal cells. Why do you do that? Because we know multiple myeloma is a non-curable disorder. What we want is the longest duration for the relapse. It means if you relapse after 5 years or 10 years, old medication will become non-expensive and new medication would have come and which will increase your lifespan further. So very, very important, say daratumumab is a new medication, CAR T-cell, teclistamab, BiTE therapies, telcitamab, erlotinib. These are all BiTE therapies which are there in the market, and blinatumab is a new medication which has come. So future is pretty bright for multiple myeloma as we know. So in a nutshell, multiple myeloma is being diagnosed with back pain, anemia, high ESR. If you have got these problems of anemia, recurrent anemias, please do contact us. And once you have given the chemotherapy in your country, which will not lead to hair fall, nausea, vomiting, it is simpler to give a 4-drug combination of DARA, VRD, followed by autologous transplant and followed by maintenance therapy for till the time the disease comes back. With this, we hope that 4 to 5 years, average lifespan will increase from 3 years to 6 to 7 years and probably for 10 years. So multiple myeloma these days is highly controllable disorder. Keep on looking for updates on this channel, and if you have got any problems regarding multiple myeloma, please do contact us. Thank you.